This is one of the most important points in the whole presentation. The original purpose for pursuing a relationship with Spectrum to ensure the long-term viability of a quality hospital located in Mecosta County. And I'll jump to the next one. Well, excuse me, let me say a couple of things first. The original point sometimes gets lost in the discussion on this topic. The original point was to make certain a hospital remains in Big Rapids, the jobs are maintained and actually can grow, and that the hospital can pursue its strategic plan. It was, in some ironic ways, all the reasons you'll hear someone might be opposed to it. We're going to lose control of the hospital's going to dry up and blow away, it's going to be something less. It will be smaller, the jobs, the services will be taken away. That's not the case. It's all the reasons just opposite of that why we wanted to merge. And some of those fears are on the next slide. But this is an interesting slide because it's a map of West Central Michigan. It's outlined, these are 13 counties, the yellow outline that Spectrum essentially considers its primary market base. All of the red crosses are hospitals that, I have too many gadgets up here. So this one works, so I'm back up just a little bit.
I've seen it.
So the red are owned by Spectrum as we speak. Reed City, Gerber, Kelsey, United, and so on. The two in Grand Rapids are Butterworth and Blodgett. The blue crosses are hospitals they're currently in discussion with. Would be us. The blue one in Grand Rapids is Mary Freebed, which is a rehabilitation hospital. I've kind of said at the other meetings, it's a one-trick pony, or something like Kentucky Fried Chicken. They only do one thing, physical rehabilitation. And it sits about a block from Butterworth. Zeeland Hospital is another one they are in discussions with currently. The other point I wanted to make with this picture is that, am I doing that?
No, it's a projector.
Okay. This is Mount Pleasant Hospital, which just recently joined with McLaren, which is in Flint, and this is Cadillac, which is in the Trinity system. So right now, as we sit, we are this is one of those, we've held out supposedly, I guess you could say, as long as you possibly could as an independent hospital. We're proud of that fact. We've done very well. I know all the people that work at the hospital are very proud of the accomplishments over the last few years. But now with healthcare reform, healthcare essentially being in a crisis, you can sort of see everybody's trying to find cover and a system to join. In about a 50-mile radius, we remain the only independent hospital at this particular point in time. This is like a test, talking and running 3 different gadgets.
You're doing well.
What is the perceived downside of merging with Spectrum? There's really 3 major issues: loss of control, fear of losing jobs, and really fear of the unknown. And that's to be understood, I think, when you make a change of this nature. There are certain anxiety that you just cannot avoid until you get downstream and your fears are allayed. Loss of control is one just to touch on for a second. The Board of Trustees would remain a local board. Currently there are 9, those that introduced themselves a few minutes ago. All of the other hospitals that I mentioned currently have local boards. The board members are nominated by that current board, and they are presented to Spectrum. Spectrum is the ultimate authority, there is no question, just like the county commissioners are the ultimate authority now. And Spectrum could potentially deny a board member. In reality, it doesn't happen. The best example I can give you, we just added 3 board members at Reed City, Chuck Holmquist, Rich Saladin, Connie Sunick-Purley from Lake County, and the local board selected those 3 people because of their connections locally, presented them to Spectrum, they were approved, they are now members of the board. And that happens in all of those hospitals. To my knowledge, Spectrum actually has never denied a local recommendation. Fear of losing jobs. I've said this, I don't, in as many different ways as I can possibly say it. We have done pretty well over the last few years. We have had a positive bottom line, small, but a positive bottom line. We have tried not to add employees at a point where we might have to cut them downstream. All of our discussions with Spectrum at this point, I have had a single discussion about cutting positions, layoffs, or anything close. Hasn't been a discussion anywhere that I've been involved in. My hope is that we will actually see an increase in jobs over time. All the hospitals that I mentioned up here all have more services, have more employees, and have a better bottom line after they've joined than prior. So there is no history of this, and there is no need in our particular case going forward. Will we do some restructuring over the next few years, maybe some consolidating, re-engineering? Yes, we would do that whether Spectrum was involved or not. We do that all the time. We just had a billing position in our Mecosta Health Services. Sherry Stern, those of you that know her, just resigned, took another position. She's the head of billing. It gives us a chance to look at reorganizing the office a little bit. Has nothing to do with Spectrum, and we would do that anyway. We will continue to do that. I mentioned in some of the other meetings, we had a cardiac rehab center out at Canadian Lakes. 3 employees in that. We put it out there because we were so crowded, we needed to spread out a little bit. We had a lot of people from Canadian Lakes driving in town. What we didn't realize is they like to drive in town and socialize, and when we put the cardiac rehab center out there, no one came to it. So we had to lay off 3 employees and close the practice, but had nothing to do with Spectrum. It was just necessary from a business point of view. Fear of the unknown is going to always exist until we get further downstream. Positive aspects of the merger: reduced purchasing costs. I thought I saw Diana here. Yeah. Diana Byrne is our purchasing agent at the hospital. She can tell you that over the past year, by using Spectrum's purchasing capability with all the other hospitals, we saved about $600,000 just this past year being in that purchasing group. And we would continue to be in that group. Access to capital for the purchase of equipment and improving infrastructure. That $44 million I mentioned in that grand plan that we developed had as much to do with replacing boilers, chillers, HVAC, etc., as it did building new buildings, because at some point in time the infrastructure has to be replaced, and it's impossible for us to afford all that. So having access to do that, replace that capital is critical. Spectrum will pay off the remaining $8.9 million debt on the ER-OR project. Those of you that have stayed close to this know in 2003 when it passed, it was a bond issue for $11 million. So it's several years downstream now, and what remains on the books is $8.9 million. Is that close, Paul? And that would come off. And Spectrum has agreed to do that as part of this merger proposition. And I should touch on this just briefly. As I mentioned, Spectrum does not purchase hospitals, but one of the reasons we had to put the project on hold in 2008 is because the Board of Trustees said that was a deal breaker. If we're going to merge, the county taxpayers have to have this taken off the books, and Spectrum agreed to do that, but they weren't in a position to spend $9 million at that point because the economy was collapsing. So that's why it was put on hold. Networking and continuing education opportunities with other hospitals. When we go to meetings, we'll be sitting there, and we've already done some of this, whether it's quality, compliance, joint commission, all those things that we deal with Gerber, Greenville, Reed City, and so on. Continued collaboration with Reed City Hospital. I think we have a few people here from Reed City. They can tell you that we've had a number of meetings in the past year or two where we've gotten to know one another and talked about projects that we can do together and ways that we can be creative, save costs, and so forth. At no point have we talked about downsizing, reducing jobs, etc. Potential for future growth and expansion. We've seen this happen in all of the other hospitals. Access to a larger base of specialty physicians. This is another one that there's some irony here, because you'll hear that if you join Spectrum, I'm going to lose my physician, they're going to end up in Grand Rapids and so forth. Again, no conversations like this that I'm aware of We'll keep the physicians that are here, and our hope is just the opposite. We'll gain more physicians by having access to their specialists. And this is another part of that, right? This fall, the freshman class started at Michigan State University Medical School that sits across the street from Spectrum, and we're hoping to have those family practitioners rotate through this area, both at Reed City and Big Rapids, and it'll give us a greater chance at recruiting physicians.